Hello, I'm Dr. Trevor Wilde. I'm a board-certified family medicine physician who practices here in St. Anthony, Idaho. I have the opportunity to also help deliver babies up at Madison Memorial Hospital. Today, I want to take the opportunity to talk to you about diabetes. This will be an overview about diabetes and give us an opportunity to later explore some more details about the differing topics that are important to your diabetes and its management. Diabetes, what is it? Diabetes is when the body can no longer control the blood sugar levels adequately, usually either due to poor response to insulin or inadequate insulin being made in the body. What are the risk factors for diabetes? One of the most important risk factors is being overweight or obese. This is considered to be a BMI over 25. Also very important is a family history of diabetes. Being over the age of 45 also increases the risk. Lack of physical activity, certain races or ethnicities, and some people having dark velvety patches of skin at base of neck or armpits. Possible risk factors also include having high blood pressure, low good cholesterol, also known as HDL, or having high triglycerides, which primarily come from the fats that we eat. Also having a history of gestational diabetes or having had a child that was born at greater than 9 pounds. History of heart disease or stroke, as well as history of depression and history of PCOS or polycystic ovarian syndrome. What are the potential complications of diabetes? This is where it's important. Plugged arteries or plugged blood vessels that carry blood to the body, to the heart, to the brain, kidneys, eyes, and even the nerves are potential complications. This can cause numbness in the body and even death from heart attacks or loss of blood flow to the brain and kidney failure. Also, loss of vision and other permanent problems can occur. What are the common symptoms of diabetes? In medicine, we refer to these typically as the 3 P's of diabetes. First, polydipsia, or an increased need to drink water and an increased thirst. Polyphagia, this means increased hunger and eating. And polyuria, which indicates that you're increasingly urinating more frequently. Some people will also have vision changes, numbness or tingling, or increased fatigue. Some may even have unexplained weight loss as initial symptoms when they present with diabetes. So how is diabetes typically diagnosed? First, we use a blood sugar test, tested twice on 2 different days when someone is fasting, which means that they've been at least 8 hours without anything to eat and with only water to drink. There is another method that we commonly use to test for diabetes. This is called an A1C, which is a blood sugar test that helps us to know what the blood sugars have been like over the last 3 months. Sometimes it's necessary for us to use other tests which are longer, such as an oral glucose tolerance test that's commonly used in pregnancy. So how is diabetes treated then? For type 2 diabetes, which is the most common, the most important treatment that we can apply is exercise and lifestyle changes. These lifestyle changes can include dietary changes or changes to the things that you eat on a regular basis to help control your blood sugars. When diet and exercise are not enough, though, there are 2 primary additional treatments. These include medications that you take by mouth or also insulin. Insulin is something that we are able to replace into the body. There are other types of injections which are given other than insulin, and you can speak with your physician when you come to see us about those other options. It is important to also make sure that we're checking blood sugars regularly, because when we attend our physician's visits, when you come to see us, we have the opportunity and the importance to be able to review those blood sugar logs. These are kept on a daily basis, often testing daily or even up to 3 times daily if you're using insulin. When your physician has the opportunity to review these blood sugar logs, It'll be important that they continue to see you on a 3-month basis or more frequently at times until your blood sugars are well controlled. After your blood sugars are well controlled, often we can keep those visits to every 3 to 6 months. It is very important though that you do not stop your medications just because your blood sugars are controlled. It's often those medications which are helping that to occur and keeping you from many of the complications that are common to diabetes. So what will my doctor typically do at each visit? Again, it's very important that we have the opportunity to review those blood sugars that you've been keeping so diligently to manage your diabetes. It'll also be important for us to order other blood tests. These will include the blood test that checks your blood sugars over the last 3 months, called an A1C, as well as checking your kidney and liver function. And at least yearly, we also need to be checking your cholesterol levels and a urine test that helps us to know about the health of your kidneys. We will also perform a foot exam of your bare feet for problems that may occur, such as sores or changes in the sensation or numbness or tingling that may occur in your feet. There are many other important tests that are important and critical into managing your diabetes well and helping to postpone or prevent those complications that are common to diabetes. These include, but are not limited to, an annual dilated eye exam by a trained professional such as an ophthalmologist or an optometrist. At these visits, they'll use medications to help open the vision of the eye to be able to see well into the back of the eye and see if there are potential complications of diabetes forming. It'll also be very important that you talk with your doctor on a regular basis to see if these visits are necessary more frequently or if other testing is necessary. If your blood sugars are poorly controlled, it may be necessary to see those doctors even more frequently until control of your blood sugars has been accomplished. Thank you so much for taking the time to watch this overview about diabetes. Please feel free to search the website for other additional helpful links. We have also included links to other areas amongst the internet pages that are so commonly available that will allow you to find additional information to understand your diabetes better. We look forward to working together with you to manage your diabetes in a helpful way.